And we begin with a Team 10 investigation. The state medical board has put a local anesthesiologist on probation after she was caught high and slurring her words on the job. Thank you for joining us this evening. I'm Kimberly Hunt. And Team 10 investigator Austin Grabish is joining us now in studio with details on the troubling case.
Good evening, Kimberly. This doctor was trusted with patient lives when she was caught high on the job, and she still has her medical license. And tonight, a consumer watchdog advocate says the California Medical Board should have handled this case differently to protect patients.
This doctor's LinkedIn says she's currently employed as an anesthesiologist for a medical group in San Diego. But exactly where Dr. Anna Bowling may be working remains a mystery. 2 years ago, she was walking into walls and slurring her words, according to the medical board, who says she was high on the job. Despite being under the influence at work, she's been allowed to keep her medical license.
It's especially concerning when a physician is found to be impaired on duty.
Michele Montserrat-Ramos has spent years fighting for tougher rules governing doctors with drug problems. She's a patient safety advocate at the nonprofit Consumer Watchdog. I turned to her to get insight about this case. The medical board says Dr. Bowling, a certified life coach in Carlsbad who works for the Anesthesia Service Medical Group, was impaired at Scripps in Encinitas in May 2022. A physician reported Bowling as looking disheveled and glassy-eyed. The doctor had been looking for Bowling after she went missing during her shift. He said she was repeatedly walking into walls as she tried to leave the hospital.
The medical board says Dr. Bowling tried to take off from here at the hospital in her car while she was high. One of her colleagues said she became increasingly agitated when he stood in her way to prevent her from taking off. At one point, another physician went and got his car to physically block her from driving away. Hospital staff then called security and police for help.
The medical board says Dr. Bowling admitted she put patient safety in jeopardy when she injected herself with propofol. It's a powerful anesthetic known as the drug that killed Michael Jackson.
So in the case of Dr. Bowling, the medical board should have issued a cease practice order from the beginning, which they didn't.
Montserrat-Ramos says the medical board isn't following California's consumer protection law.
The cease practice order doesn't allow the doctor to continue practicing for at least 30 days, and it allows the doctor to begin drug testing for 30 days. In that way, the board can determine whether the doctor is truly a substance abusing physician.
Team 10 asked the medical board to respond to Montserrat-Ramos. A spokesperson said the board can't issue a cease practice order until after it's done an investigation. But Montserrat-Ramos is adamant the board is not following state standards.
So if I'm understanding it correctly, a doctor can be battling a substance abuse issue, the medical board can know about it, and they don't have to tell a patient?
No.
The medical board told Team 10 it can order doctors to tell their patients about their substance abuse issues, and it is requiring Dr. Bowling to do just that. But Montserrat-Ramos says the board rarely requires the patient notification. Records reviewed by Team 10 say Bowling admitted she could have been called to the operating room while high. She told the medical board she took propofol to decrease the emotional pain she was feeling and admitted she had stolen the drug before, along with narcotics, including fentanyl and hydromorphone. In just 1 month, she stole drugs at least 11 times, according to the medical board. Scripps Health told Team 10 Dr. Bowling hasn't worked at one of the company's facilities since the May 2022 incident. A spokesperson pointed out physicians are not employees of Scripps. Instead, they are members of an independent, self-governing medical staff. Dr. Bowling's attorney told Team 10 the medical board found her fit to practice medicine with the restrictions it imposed. They include not using drugs or alcohol, attending a substance abuse group, and random drug testing. He says his client has shown extraordinary dedication to her well-being and her patients, and took ownership of her mistake before being disciplined. Quote, she has been and will be fully compliant with the medical board's terms and conditions. Moving forward, Dr. Bowling hopes to make a positive impact on the well-being of other physicians and medical professionals.
For her sake and for her patient's sake, I truly hope that she does find, a road to recovery.
Montserrat-Ramos is calling on the medical board to start following uniform standards for substance abusing doctors. The board maintains it already is.
These standards, are California law, and, they provide these protections for everyone.
As part of her probation, Dr. Bowling is no longer allowed to see patients alone except in special circumstances. I asked the medical group listed on her LinkedIn for comment, but didn't get a response. So tonight, we still don't know if she's working for that company or somewhere else in the county. The medical board has ordered Dr. Bowling to pay $56,000 for the cost of its investigation. She must also take an ethics course and will be on probation for 7 years. I cover the Medical Board of California, military investigations, and am one of our government watchdogs. If there is a story you would like to tell me about, you can email me, austin.grabish@10news.com. You can also scan the QR code on your screen. Kimberly, back to you.
And it's such an important information for patients to know. Thank you, Austin, for
You're
that
welcome.
story.